Hi, I'm Dr. Sharbell Hashoul, and today let's talk about something a lot of people worry about before their first mammogram. Is the radiation actually safe? It's a completely fair question. The word radiation can sound scary, especially when it's connected to something meant to check for cancer. But let's break down what's really happening inside that machine and put the numbers into perspective. A mammogram uses a very small dose of X-ray radiation to create images of the breast tissue. We're talking about a dose that is genuinely low. For a standard 2-view mammogram of both breasts, the amount of radiation is roughly similar to what your body naturally absorbs from the environment over about 7 weeks of ordinary daily life. That includes things like cosmic rays from the sun and natural background radiation in soil and air, things we're all exposed to constantly without even thinking about it. To put it another way, some people compare the dose in a mammogram to taking a couple of round-trip flights across the country. Flying exposes you to slightly more radiation than usual because you're higher in the atmosphere, closer to cosmic rays. A mammogram is in that same general ballpark, small, brief, and not something your body has trouble handling. Modern digital mammography has also made this even safer over the years. Today's machines are calibrated to use the lowest dose possible while still producing a clear, useful image. Radiology teams follow strict safety standards and regular equipment checks specifically to make sure the dose stays as low as it can be while still doing its job well. So why do we accept even this small amount of radiation at all? Because the goal of a mammogram is to find breast cancer early, often years before it could be felt as a lump or cause any symptoms. Finding cancer at an early stage generally means more treatment options and better outcomes. For the vast majority of people in the recommended screening age range, the benefit of catching something early outweighs the very small theoretical risk from the radiation dose itself. It's also worth mentioning that researchers have studied this question for decades. Large studies looking at populations who get regular mammograms have not shown that routine screening mammography at these low doses meaningfully increases a person's risk of developing cancer. The dose is simply too small and too infrequent, especially compared to the clear, well-documented benefit of early detection. Of course, this doesn't mean radiation exposure should be ignored entirely. That's exactly why mammograms aren't recommended for everyone. Every year, starting at a young age, screening guidelines are built around finding the point where the benefit of early detection clearly outweighs any small risk, which is why your doctor may ask about your age, family history, and personal risk factors before recommending a screening schedule that's right for you. Here's a practical takeaway. If you're ever nervous about the radiation in a mammogram, you can ask your radiology technologist directly what dose your specific machine uses, since newer digital and 3D mammography units are often even lower dose than older equipment. You can also ask your doctor how often you personally should be screened, since that recommendation can vary a little depending on your health history. There's no need to guess. Asking questions is always welcome. At the end of the day, mammograms remain one of the most well-studied, carefully regulated medical tests we have, and the radiation dose involved is small and thoughtfully managed. As always, this video is meant to give you general understanding, not personal medical advice, so please talk with your own doctor about your individual screening needs and any questions or symptoms you may have. Thanks for watching, and I'll see you in the next video.